Hello everyone, good morning, good afternoon, good evening, depending upon where you are. I am Miss Keller, for those of you who don't know me, but I think if you're watching this, you probably follow me and you know who I am. Anyway, sorry for the background noise. My neighbor, who's joined? Hello, Dudette. East-West Functional Training, hello, welcome everyone. So I apologize, let me wave. That's because I can and it's fun. Okay, I apologize for the background noise. My neighbor suddenly decided to use the leaf blower. Hello, Dennis, welcome. My neighbor decided to use the leaf blower right when I was about to start my video. So, yeah, there's that happening. Okay, what I wanted to share with you guys today, happy Saturday, yes. A lot of you have expressed to me that you're dealing with some neck pain, some neck discomfort, neck stiffness. Gosh, I can't even talk. So I wanted to share some solutions with you today and things that you're going to want to add into your self-care routine to help deal with those issues. So before we talk about that, a lot of you have told me that you have neck pain. A lot of you guys have been women who've shared that with me. And I don't know if you're aware, but research shows that women tend to have more chronic pain issues than men. Sorry, I'm going to use my notes now. So women seem to have a greater tendency to have, men seem to have a greater tendency to have herniated disc and back issues, but women tend to have more sudden onset pain, and that could range anywhere from mild aches to something more severe like fibromyalgia. And one of the reasons that they think this is happening is because of our hormones. And, we have radical fluctuations in hormones throughout the month and also throughout our lifetimes. And studies have shown that the hormone estrogen, these hormones, the fluctuating hormones alter our cellular functions as we age. So that's the key thing to remember. And estrogen can dampen the activity of pain receptors. And so these are the sensory receptors that actually live in your connective tissue system. So that's important to remember also. And so the effect that estrogen has actually helps women to tolerate higher levels of pain, which is super good when you're doing things like having babies, right? So during the low estrogen parts of either our cycles, our menstrual cycle, or even after menopause, then suddenly now your pain receptors are more sensitive and they're sending more of those pain signals to your brain. So can we help our sensory nerves stop altering the brain to produce the sensation of pain in our bodies? And the answer is yes. And I'm going to show you 2 moves today that if you're having neck pain, having chronic neck pain or discomfort or stiffness, you're going to want to add these 2 moves into your self-care routine. So I'm going to move Mr. Bone Jangles out of the way so I don't knock him over. So what I'm going to talk about today is our low back release sequence. Now, why am I talking about low back release sequences when I just set up the neck pain thing, right? So when we are doing melt techniques, we always want to go indirect before direct. The beautiful thing about our connective tissue system is that it is seamlessly connected from head to toe and skin to bone. And that's really kind of the magic and the power of it, that you can treat any part of your body and it's going to affect your whole entire system, especially because all of the other systems in your body are relying on the health of this tissue to do their jobs, okay? So when we melt and when we hydrate the tissue, you a lot of times will notice indirect changes in your body. And this is something that I teach in my 90-minute mobility sessions, is I teach you how to identify where you're having these areas of stuck stress and where the tissue is dehydrated. And then we apply the techniques, and then you reassess at the end, and you notice these changes immediately. So you may notice that we may hydrate the upper back, but then you notice that something in your pelvis has shifted, and the way that the way your body is perceiving where your pelvis is has shifted also. So if you have neck pain, discomfort or stiffness, you're going to want to do the low back release sequence. You're going to want to add that one in. So this consists of, we always assess in the beginning, apply the techniques, and assess at the end. That's one of the magic that's part of the magic of doing melt method techniques, is noticing those changes. So we start with a rest assess. We do a little lower body work. Again, not anywhere near the neck. We're in the lower body. We do a little back of thigh shear. We do a little SI joint shear. Your SI joint, show Mr. Bone Jingles here. Your SI joint, or joints, there's two of them, are right here. And they're right, your tailbone kind of not locks in, but it slides right in here in the between your pelvic bones. And this is kind of, it almost acts like a keystone, and it helps to support your pelvis. And these two SI joints can get locked up, and they lose their ability to move like joints should. And so doing a little SI joint shear here is super important, because you can see, like, our whole body's connected. So if this isn't moving properly, it's going to radiate all the way up here, and you're going to feel it in these spaces. And when we work together and do our 90-minute session, we talk about, and you guys learn about what the masses and spaces are in the body. But this is a space, and this is a space, so that's going to really affect and compress those areas. So you really want to make sure these SI joints are moving. So we do a little SI joint shear. Then we move in to these two moves that I'm going to show you today. I'm taking my glasses off. So the next two are the pelvic tuck and tilt challenge and the low back decompress. So again, why are we working on the low back? Because we want to experience those indirect changes. So usually when I work with a client, wherever the pain point is, we start kind of like in the opposite end, and then we work our way to that point, especially if that area is really inflamed or you have an actual injury there and you really don't want to keep punching on it and aggravate it even more. That's one of the most powerful things about melt. You can treat another area of your body and still help to support your body's natural healing mechanisms to heal the place where there is an actual injury. All right, I'm going to stop talking about that and show you. Okay, so pelvic tuck and tilt challenge. You're going to need a melt soft roller. This is a roller that's specifically designed for melt. If you do some of these techniques on a hard roller, you can actually hurt yourself. So if you're going to do these melt techniques, you're going to want to get a melt soft roller. You can DM me and I can help you get the right tools. So you're going to place this right on the widest part of your pelvis, and your knees. Sorry, I was setting myself up for SI joint shear, because that's what I normally do when I get my knees on the hips on the roller. All right, so your knees are going to be perpendicular to the roller. Let me turn this way just slightly. You're going to straighten your arms. You're going to place your palms on the front of your thighs, and you're really going to think of keeping your ribs heavy into the floor. We don't want to arch here. You're going to keep your ribs nice and heavy. You're going to keep your arms nice and straight. You don't want your shoulders up here. So really keeping those arms nice and straight. Pressing. This is the secret right here to the pelvic tuck and tilt challenge. You're going to press your hands into your thighs, press your thighs into your hands. Okay? And you want to maintain this pressure as you move your pelvis. So what we're going to do, we're going to inhale, and as you exhale, you're going to tuck your pelvis, lifting your pelvis, your pubic bone off the roller. Then we're going to inhale, exhale, then you're going to tilt your pelvis. And again, the key here is maintaining this pressure hand to thigh, thigh to hand. So inhale, exhaling, tucking the pelvis. Inhale, exhaling, and tilt. And as you can see, the tuck and tilt is really slight. Like, I know I'm doing it, but you may not even be able to see it. It's very small and powerful. Small but mighty. So inhale, exhaling, tucking. Inhale, exhaling, tilting. And one more, inhale, exhaling, tuck. Inhale, exhaling, and tilt. So then you want to stay in this tilt and do your low back decompress. So we do something in melt what we call the sh works. And this is where we find our core, and we use a sh, s, or ha sound in order to do that. And I can teach you that again in the 90-minute session. We always teach a rebalance sequence because it's like so powerful and magical. But we practice that, and you find your sh, s, or ha sound that works best for you during that sequence. So I'm going to use the sh sound today. So we're just going to inhale, keeping your pelvis in a tilt, keeping it heavy on the roller. Hand to thigh, thigh to hand. Inhale. Inhaling again, easing off pressure. And pelvis is still in a tilt. Hand to thigh, thigh to hand, pressure is still engaged. And that's it. And then you're going to come off the roller. That's the end of the sequence. And then you go back and you do your rest assess. I'll do another video another time about the assessments because they're awesome. So, yeah, if anybody has any questions, please let me know. Let me wave at Dennis. I didn't get to wave at you, Dennis. So yeah, if you have any questions about it, let me know. But that's a really quick and easy sequence. We actually do this particular sequence. I teach a melt performance class right before my pound class to get our bodies, get the tissue hydrated, and we do some particular specialized techniques that help to stabilize our joints. So we want to get our tissue hydrated, get our joints nice and stable before we start bebopping around in pound class. So this is these are some of those moves that are actually included in the sequence, at least the one that we've been doing lately has these in there. So again, if you're having any kind of neck pain, neck stiffness, neck discomfort, don't discount the stiffness and discomfort, right? And don't say, well, it doesn't really hurt. It's not like pain. I'm not having like chronic pain, or I don't have the pain all the time, but my neck is really stiff all the time. So that is what we call a pre-pain signal. That's your body giving you a little nudge. Your body's always giving you information. It's just a matter of learning how to listen to it and then learning how to give it what it needs. So when you have that stiffness, or just even like just some kind of discomfort in your neck, that's your body's way of saying, hey girl, hey, or hey boy, hey, I need some help here. And adding in these techniques, grab my roller, adding these techniques and using the roller or using our hand and foot kit, these are some excellent ways to treat your body when you're having those pre-pain signals, so then it doesn't escalate to a pain signal. And then just kind of wrapping up back to what we were talking about in the beginning, it helps to bring balance to your nervous system, and that is going to help your brain not send so many signals to your body of pain, so you're not feeling that sensation of chronic pain all the time. And that's what we want. I want you guys to feel awesome in your bodies. You deserve it. It's our birthright to feel amazing. We live in these phenomenal vessels, and if you stop and think about it, it will blow your mind. I was actually, someone's joined. Oh, hey, Paris. I was actually thinking about it this morning. This is like way off topic, but my daughter, crawled in my lap this morning after she woke up, and I was just holding her. She likes when I rock her, and so I was rocking her, and my brain went to this really, really weird place, and I was thinking about like how she started out her life. She started out as like a little sperm and a little egg, and they came together, and it just knew to start multiplying, and like that was where she started, and now she's like this big 6-year-old in my lap. And even once she got out of me, her body still knows what to do and how to continue replicating those cells and growing, and like her heart knows how to beat, her gut knows how to digest her food. Like it was just blowing my mind at like the knowledge and the wisdom that's in our bodies. It's magical. It's like otherworldly. So take care of this body. You deserve to feel wonderful in it. If you're not feeling wonderful in it, please DM me. I would love to spend some time with you and focus on your pain points and the areas that, any goals that you have set for yourself, and give you some tools, give you some techniques. We'll put a specialized map together for you to use to help you get out of chronic pain, to help you reduce the stress in your life and reduce the effects of chronic stress on your body, and get your body strong and stabilized, and so you can help prevent injuries and love the body that you're living in. So thank you so much for being here with me today. Thank you for listening. And DM me today. I do have a couple spots still available for June. Probably next week I'm going to start booking into July. So if you're interested, please DM me today. I'd love to work with you. All right. Bye, Mr. Bone Jangles. Lean in there. Bye.